ischemic stroke caused by a blockage in an artery and an hemorrhagic stroke caused by the rupture of a blood vessel is a life-threatening attack affecting all areas of the brain and is the third most common cause of death. In Australia, around 55,000 people have strokes annually.
Symptoms include difficulties with speech, vision and coordination, facial and body muscle weakness. Right cerebral hemisphere stroke causes left-sided weakness or permanent paralysis, sensory, spatial and memory impairment. Left hemisphere stroke causes right-sided weakness or paralysis, behaviour and memory impairment. Other regions can cause problems with heart function, body temperature regulation and swallowing. Treatment for ischemic stroke includes the use of a blood clot dissolving drug to prevent a second stroke, medicine injected into the brain or surgery to remove the blockage. Treatment for hemorrhagic stroke includes the use of a drug to lower pressure. If bleeding is too severe, surgery will be required to remove excess blood and repair a ruptured blood vessel.
Two common imaging modalities that can be used to diagnose stroke are computed tomography, also known as a CT scan, which electronically generates an image of a tissue or organ that can be manipulated via technology, and magnetic resonance imaging, commonly referred to as an MRI, which uses a magnetic field and radio waves to generate an image. CT scans, while sharing similar imaging abilities to an MRI, are more efficient and economical. However, an MRI allows the visualization of finer details better than a CT scan could. Currently, CT scans are the preferred method to image a stroke due to the visualization of significant detail as well as being more affordable and accessible to the general public. Examples of areas in the brain that a stroke injury can occur can be seen in the CT scan clip shown. Highlighted in red are the areas of different locations stroke damage can occur throughout the brain.
Here are 3 axial slices of the brain using CT, with the following structures identified. The radiopaque anterior and posterior horn of the right and left lateral ventricles, separated by the semi-radiopaque septum pellucidum, with the semi-radiopaque caudate nucleus lying adjacent. A radiolucent line running anteriorly and posteriorly is part of the falx cerebri. The skull can also be seen as radiolucent structure surrounding the semi-radiopaque cerebral tissues.
The first image by QIT-D is a CT of a healthy patient's brain. The second image, displayed by Diagnostic Imaging Pathways, shows a CT of an ischemic stroke of the right middle cerebral artery. This radiopaque mass is indicated by the red circle as an ischemic stroke, causing loss of blood and nutrients to the surrounding cerebral tissues, causing tissue atrophy and increasing the size of the lateral ventricles in comparison to the healthy patient. The final image by Smith-D, which exhibits a CT image of a hemorrhagic stroke. This radiolucent mass indicated by the red circle is a hemorrhagic stroke due to blood pooling in the surrounding area and places increased pressure on the surrounding tissues. This increased pressure can be seen to reduce the size of the right lateral ventricle in comparison to the healthy patient.
It was found that in 2013, over 9% of stroke patients were initially misdiagnosed in emergency departments. A similar study from 2007 documented 15 cases of misdiagnosed ischemic stroke and patient outcomes. All patients had similar symptoms, and after both neurological exams and CT scanning, the diagnosis ranged from migraines, meningitis, toxic encephalopathy, and gastroenteritis. It was found that most patients returned to hospital with complications after incorrect treatment, and later 6 out of 15 of these patients died from these complications. Moving forward, the ability to make detailed MRI scans easy to access, cost-effective, and producing faster results would aid in preventing misdiagnosis in the future.